Now we're actually going to work on what I call the rotational roll. But I really want to strongly emphasize that unless you're comfortable and you're not putting too much force into your chin tuck, then you're ready. But if it takes a lot of work to do the chin tuck, I would really say that you should stay with the chin tuck until that gets easier to do with less force. And once it is there without a lot of fight, then you can begin what we call the rotational roll. And the reason I call this a rotational roll is that we're not just going to spin our head, we're actually going to maintain contact with a mild chin tuck. We're actually going to maintain the contact with your head to the towel or the floor, and you can see that we're actually rolling. And that roll then really helps to open up the other side of the facet joints. It opens up space. It's a nice rotational side tilt stretch. And we're going to hold this for about a minute to a minute and a half in each direction. Now, if you meet yourself with pain at a particular area, stop at that area, back it to the point of where it's comfortable and stay there. Otherwise, go to where you feel mild tension. Do not force again. We don't want the body going into that guarded sympathetic position, which is not a healing position. So stay right here for 1.5 to 2 minutes. And once you're done with that, you're going to actually keep your chin tucked a little bit. You're going to roll to the other side. And again, when you meet that mild tension, hold it there. And in this position, remember, we don't ever stop that slow, gentle breath, feeling that go in and out of your body. And plus, we continue to feel and sense the tension. We want to keep our minds here. We don't want to be thinking about what we have to do and what we didn't do. It is about being very, very aware of what's going on. And then once you've reached that time again, you'll come back, and then you'll roll to the other side again and repeat the process 2 to 3 times depending on how you feel. But remember, I want to emphasize again, if you need support back here, and once you feel comfortable, you can actually decrease the amount of support. You can slowly work yourself back, and that's ultimately what we want to do. And again, we're not here to change you overnight. We're here to change the structure of tissue over time. And be patient.